Welcome to the American Journal of Managed Care Peer Exchange editorial video series, The Burden of Comorbid Cardiometabolic Disease in Cardiovascular Health, Identifying Optimal Therapeutic Strategies in a Dynamic Managed Care Landscape. My name is Dr. Peter Salgo. I'm a professor of medicine and anesthesiology at Columbia University in New York and an associate director of surgical intensive care at New York Presbyterian Hospital in New York. I have the privilege today of moderating a discussion where we will focus on the relationship between cardiovascular or CV health and comorbid cardiometabolic disorders. One of the most notable contributors to CV disease and stroke is diabetes, which affects an estimated 26 million Americans and is the seventh leading cause of death in the United States. Our goal is to provide you, our audience, with a range of expert perspectives on current challenges and important issues facing today's managed care professionals. For today's discussion, I'm joined by leading experts in a wide range of experience in these areas. David Calabrese, RPH, MHP, Vice President and Chief Pharmacy Officer of Catamaran Corporation, Lisle, Illinois. Kenneth L Schaecher, MD, FACP, CPC, Medical Director, Select Health, Murray, Utah. Yehuda Handelsman, MD, FACP, FACE, FNLA, Medical Director and Principal Investigator, Metabolic Institute of America, IP President, American Association of Clinical Endocrinologists, Tarzana, California. And joining us remotely will be Michael Weber, MD, Professor of Medicine at the SUNY Downstate College of Medicine in Brooklyn, New York. I want to, before we start, thank all of you for being here today, and I think it's time to get started. The rising burden of comorbid cardiometabolic disease, that's what we're discussing, a clinical and economic perspective. And why don't we start with Dr. Handelsman? It's well known that diabetes often does not strike alone. So how often are patients with diabetes presenting with other comorbid cardiometabolic conditions, and which types?
So when we look at diabetes, we have to recognize that we generally look at two types of diabetes. There is the type 1 diabetes, which usually strike the young population, maybe younger kid. They're usually thin, and they usually do not come up with any comorbid situations like hypertension or lipid disorders. The majority of people with diabetes, this epidemic that you kind of touched upon by talking about that many people with diabetes, they are type 2 diabetes. This is diabetes associated with obesity and insulin resistance. It has therefore the appearance together with hypertension. And I would say that, anywhere from 50 to 70% of people with diabetes do have high blood pressure. Also, there is the dyslipidemia, the lipid disorders of people with diabetes. We're looking here at probably anywhere from 70 to 90% of people with diabetes that would have high triglyceride, low HDL. And even though the LDL does not seem so high, it's still bad enough to cause a lot of disease. And therefore, the majority of people with type 2 diabetes are at a very high risk for cardiovascular disease, hence the issue of comorbidities with them that put them in that kind of a high risk.
Is it, let me get this straight, because type 1 diabetes presents younger, perhaps more acutely, you pick it up pretty early. It's the type 2 that sneaks up on you, and by then, if I understand what you're telling me, everything else is going wrong too.
Well, absolutely. And a type 2 actually may start 20 years before, when insulin resistance starts up. And then on top of it, there is slowly increasing glucose and slowly increasing blood pressure and some atherosclerosis developing. By the time people have prediabetes, they already may have a lot of cardiometabolic morbidity on them. And typically, because traditionally we used to check glucose fasting, typically people are being diagnosed like 5 years after diabetes has even started.
I heard a mumble on this side.
Well, no, it's certainly true, and I think that that's one of the somewhat mistaken beliefs with regard to diabetes, is that diabetes is an endpoint. It's really a point in a spectrum of disease that oftentimes begins many years earlier, and though we may be focusing on the diabetes as a disease state, really it's the pre-diabetic conditions, the obesity particularly, that may lead to the development of the diabetes that we fail to focus on adequately.
if I hear what you're saying, and this is a very profound point, it's the diagnosis of diabetes is not binary. It's not one day you don't have it, the next day you do. It creeps up on you. Is that your experience too, Dave?
Some of the statistics that are out there today, I think 1/3 of our U.S. adult population is pre-diabetic.
1/3?
1/3. And,
Yeah,
and,
just
you know,
about.
the reason why we're seeing, 8 to 10% increases in the numbers of people that are being diagnosed annually, and that's been consistent over the course of the last 20 to 30 years. We're seeing these consistent increases. It's largely as a result of what Ken's talking about. It's the increasing, not only the increasing age of our population, but poor nutrition, poor exercise, obesity, as an epidemic within this country.
I want to get to all of that.